In this video, we're going to be performing a combined movement mobilization and or grade 5 manipulation for the thoracic spine. So this is a good position for the thoracic spine. If you want to isolate it more, you can have them seated on the corner of a table just to take that lumbar spine out and really isolate the thoracic spine. You're going to have them cross their arms. Okay, now for you as a therapist, you can come up underneath and hold the arms just like so. You can come to the thoracic spine and be central, or you can come off towards transverse process, and you can utilize hypothenar just like so as your mobilizing hand. Now if you would want, you can combine some flexion with some rotation and side bend and then perform your mobilization there. You also can extend, side bend and rotate away and perform your mobilizations like so. Everything would be the exact same. If you wanted to do the grade 5, you would take them all the way to where you get to that end range position and then just throw straight through. Through.